Introduction. Light background music fades in narrator. Welcome to today's lecture on the topic of laryngomalacia. As future medical professionals, it is essential for you to understand the intricacies of this condition and its management. Laryngomalacia is a common congenital anomaly that affects the larynx, leading to symptoms such as stridor and feeding difficulties in affected infants. In this comprehensive lecture, we will delve into various aspects of laryngomalacia, including its embryology, pathogenesis, clinical presentation, diagnosis, treatment options, potential complications, long-term prognosis, and the support needed for affected families. Upbeat background music fades out. Laryngomalacia arises from disruptions in the embryonic development of the larynx. Understanding this process is vital in comprehending the mechanisms of laryngomalacia and developing appropriate treatment strategies. Anomalies primarily affect the arytenoid cartilages, leading to collapse during respiration. Laryngomalacia is a condition where the upper airway structures collapse during breathing, causing obstruction. The causes involve abnormalities in laryngeal tissues, such as cartilages, muscles, and mucosa, as well as mechanical and neurological factors. Understanding these factors helps in developing effective treatments. In the section on the classification of laryngomalacia, we will explore different classification systems used to categorize and diagnose this condition. These systems provide valuable insights into the severity and specific characteristics of laryngomalacia, aiding in treatment planning and effective communication among healthcare professionals. Professors voice over laryngomalacia can present with various symptoms that may resemble other conditions. Accurate diagnosis is important. Common signs include noisy breathing, difficulty feeding, and occasional breathing problems. Distinguishing it from other causes of stridor, using thorough evaluation and imaging, is crucial. It's also essential to recognize any accompanying serious conditions, such as heart diseases or syndromes. With a good understanding of these clinical aspects, physicians can develop suitable treatment plans and intervene promptly. Laryngomalacia rarely occurs in isolation but is often associated with other congenital anomalies. Comprehensive evaluation and screening for associated anomalies are crucial in managing patients with laryngomalacia effectively. Various body systems can be affected in conjunction with laryngomalacia, including the cardiovascular, gastrointestinal, renal, and musculoskeletal systems. These associated anomalies can significantly impact the management plan, surgical decision-making, and overall prognosis. Performing a thorough clinical examination, along with appropriate imaging studies and consultations with subspecialists, aids in detecting and evaluating potential co-occurring abnormalities. Collaboration with geneticists is particularly important when syndromic associations are suspected. It is imperative for healthcare professionals to be diligent in recognizing and managing associated anomalies, as their timely identification profoundly influences patient outcomes and guides appropriate multidisciplinary care. Soothing background music continues. Transitional music fades out. This video segment discusses the diagnostic tools used in diagnosing laryngomalacia, including flexible laryngoscopy and imaging techniques like CT and MRI. These tools provide detailed evaluation of laryngeal anatomy and help identify associated anomalies for accurate diagnosis and treatment planning. Obstructive sleep apnea, OSA, is a common comorbidity in patients with laryngomalacia. Polysomnography is a valuable diagnostic tool used to assess sleep-disordered breathing, quantify respiratory events, and monitor oxygen desaturation levels during sleep. Polysomnography provides invaluable data concerning the severity of OSA, allowing clinicians to determine the appropriate management approach. Continuous positive airway pressure, CPAP, therapy or other interventions may be necessary to alleviate symptoms and prevent long-term complications associated with OSA. By incorporating polysomnography into the diagnostic evaluation of laryngomalacia patients, we can identify and address coexisting sleep-related breathing disorders effectively, promoting better overall outcomes and quality of life. Soothing background music resumes. Non-surgical approaches, including positional changes, feeding modifications, and medication options, are important in managing laryngomalacia. These interventions aim to improve breathing, reduce feeding difficulties, and address associated issues like reflux or swallowing problems. Taking into account individual factors is crucial for effective treatment. Surgical background music fades in. Supraglottoplasty is a surgical procedure used to treat severe laryngomalacia. It involves removing excess tissue in the supraglottic region to improve airflow and relieve symptoms. Different techniques are available, each with their own advantages and considerations. Success rates are generally high, but potential complications exist. Laryngomalacia can have serious complications and long-term effects if not properly treated. These can include respiratory problems, difficulty feeding, recurrent infections, and even life-threatening events. Long-term effects may include persistent airway collapse and psychological and developmental issues. Early diagnosis and proper management are crucial. Text on screen. Long-term follow-up and prognosis of patients with laryngomalacia. Narrator. Long-term follow-up is important in caring for patients with laryngomalacia, allowing for symptom monitoring, evaluating treatments, and detecting complications. Collaborating with healthcare experts ensures comprehensive care. Most cases resolve by early childhood, but some require ongoing management based on various factors. Research improves understanding and management. Upbeat background music continues. As healthcare professionals, we have a crucial role in providing counseling and support to families affected by laryngomalacia. This involves discussing the condition, treatment options, potential complications, and offering resources and support groups to address their concerns and provide guidance in managing their child's condition. In conclusion, laryngomalacia is a complex condition that requires a comprehensive understanding. We have discussed its embryology, pathogenesis, clinical presentation, diagnostic techniques, classification, management options, and complications. Early recognition and appropriate intervention are vital for optimal care and outcomes. Keep up the great work in your medical studies.